and I am Lorenzo Daniele. I am a dental private practitioner, a clinician from L'Aquila, Italy, and I'm going to introduce my webinar, just sharing the screen. And okay, so, and first of all, before my lecture, I want to thank Mrs. Grace Lee and Mr. Chi from the Neobiotech company. And this company kindly invited me to take this international webinar. And I also to thank Mr. Roberto Fumagalli from Butterfly Italy, who supports me in my courses activity. I'm very proud to be a GAO core member, and I'm also proud to be an active member of the Italian Academy of Microdentistry. Now I'm going to take my lecture, whose titles you see is the Sinus Crestal Approach, 10 years of clinical experience with different techniques. And as you listen, at the end of the lecture later on, I will answer to the question you would ask. So let's start. We learn from the periodontal literature data that the posterior maxilla is the anatomical region where it's frequent to have teeth loss. And in particular, the most frequently teeth missing are the upper molars. In fact, in our daily clinical practice, very often we have to manage rehabilitations of the posterior maxilla. But unfortunately, not usually in our everyday patients, we found situations like the ones that you are seeing on the radiographs, where thanks to a great amount of residual crestal bone available, it's quite easy to insert some implants just following the drilling procedure of any implant system. Instead, more frequently, we have to deal with these kind of conditions where a lack of residual crestal bone and with the requirement by our patients to have a rehabilitation by positioning of some implants in that zone. So definitely we need to execute a maxillary sinus lifting procedure. About the surgical techniques for maxillary sinus lifting, we can divide them into two different categories, the lateral approach and the transcrestal approach. Nowadays, the current implantology tendency is to reduce the surgical invasiveness. In fact, more often we talk about a mini-invasive implantology. And talking of mini-invasive implantology in sinus augmentation cases definitely means to talk about the transcrestal approach. The crestal approach presents many advantages. The main one is the reduced invasiveness, the reduced surgical invasiveness. That is due to the incisions that are confined in the keratinized gingiva, and that leads to a greater vascularity in the sinus vestibular wall, and we obtain also a better healing. And another great advantage is to have lowered post-surgical after effects. In fact, our patient usually have nearly absent edema, absent hematoma, a very light pain, and a minor need for medicines. And these characteristics are very appreciated by our patients. In my clinical practice, the first crestal technique I used was the Summers technique that is described on the publication that you are seeing on the slide. In these pictures, you can see a brief description of the technique that required the use of some osteotome. With this osteotome, we have to create a fracture of the sinus floor cortical plate, and then we have to make some insertion of grafting material, and this grafting material is pushed by the osteotomes to make a deformation and the lifting of the membrane. After the grafting and the lifting procedure, it's possible, as you see, to insert an implant. Now let's see a case, one of my cases, treated with this technique. This is a particular case because the patient asked me strongly a new tooth on this little space, and the only way was to insert an implant by executing a sinus augmentation. In the short video that you are seeing, you can notice the percussions required to obtain the lifting with the osteotomes. These little movements that you are seeing are caused by some percussions that are performed by using a hammer on the osteotome. So it's necessary to use a hammer on the osteotomes, and usually the patient's feeling bring to bad feedbacks about this technique because of these percussions. Nevertheless, it's possible to achieve also satisfactory results. This is the finalization of this particular case, and this was the initial situation, and this is the radiograph 8 years later, where you can find the result, also the stabilization of these results. Then the second crestal technique that I used in my clinical practice is the localized management of sinus floor that is associated with the edentulous ridge expansion technique. This technique was published by an Italian group, as you are seeing, led by Dr. Scipioni. That's one of my professional mentors. This technique consists in executing a bone flap to make a bone crestal expansion. Then, using some bone expanders inserted through the expansions created and making some movements with these expanders, we can obtain a lateralization and also a lifting of the sinus floor and of the sinus walls. So to obtain and to create a space where it's possible to insert the implant. In my opinion, although it's a technique that is used by many practitioners, especially in Italy, it's too much an operator-dependent technique. Now we can see a case that I treated some years before with this technique. This is a radiograph from 2005, and we can see some pictures from the surgery. So after a mucosal partial thickness flap, we have to create a bone flap just to separate the two corticals, the vestibular one to the palatal one, and to create a space where we can insert the osteotomes, the bone condenser. And these osteotomes, these bone expanders, with these expanders, we can make some movement to have a lateralizations of the wall and also a lifting of the sinus floor, just to create a lifting and also a space where it's possible to put the implants. The remaining space could be filled by the use of some collagen and also by the use of some bone substitute. And at the end, we can place the implants. As you can see in this short video, it's also possible to put the implant by pushing with the osteotome with some percussions to have a greater primal stability of the implants between the two cortical that are separated. In the radiograph, you see the immediate result. Then this result is going to have a stabilization, as you can see in the final radiograph of this case. And I have also a control 12 years later of this case that can show us that this stabilization has a very long time, and these two implants are still in the mouth of my patient. Another technique I used in the past is the Dr. Koshi technique. This is the first technique I used that requires a special drill to perforate the bony sinus floor without damaging the membrane. Then we proceed with the insertion of bone substitute grafts that is pushed by a bone condenser. Then the graft material causes a deformation and also a simultaneous lifting of the sinus membrane. In this way, we can obtain a localized maxillary sinus lifting. Let's see now some clinical cases that I treated with this technique. You see the initial radiography and also the initial CT scan. If you look at the distal referee, to put an implant, it's required to perform a sinus augmentation in the side. Let's see some pictures from the surgery. In the first picture, you see the special drill that is used to reach the membrane, to have the perforation of the cortical before reaching the membrane. It's possible to probe to check if the floor sinus is still intact, as in this case. So I used a longer drill to reach the membrane. And then it's possible to probe the membrane. And if you probe the membrane, you have a sensation of an elastic little movement. That's proof that the membrane is still intact. Then it's possible to begin just the grafting sequence. And usually the first layer I use, it's a collagen layer, little layer. Then by using some bone substitute, I can push this bone graft with the bone condenser that is pushed by the hammer to make the lifting procedure. So you see the bone grafting, then the bone condenser, and as you can see in these slides, we have to use also in this technique a little hammer to make some percussion on the bone condenser to push the graft material to elevate the membrane. So also in this case, the patient feelings are not so good because of the use of this little hammer. You have also a nice photo taken through the magnification of the microscope that show us the residual crestal bone and also a view of the inside zone of the augmentation in the sinus just before placing the implant. Let's see the case through the radiographs. You see the initial scan, and then you can see the immediate post-op radiography that I'm trying to show to you with the pointer. You see a dome-shaped deformation on the membrane, and also the quantity of augmentation that are reached in this case. This grafting material is going to have a reshaping with the maturation, and the final result is the one that is on the right side with the final prosthesis. I have also a CT scan after the finalization of this work. And if you compare the initial CT scan and the final, you can clearly see that the shape of the sinus floor was completely different. And also you can note the amount of elevation of lifting that I have reached in the zone with this technique. This is the situation in 2006 about this case, and this is a control 12 years later, as you see very clearly that the situation is quite stable about the augmentation that I've reached. Let's see another clinical case. It's very clear that from this radiograph, it's necessary to do augmentation procedure, of sinus augmentation procedure. So this is the immediate post-op radiography, where you can notice the augmentation that I reached, and also the classical dome-shaped deformation of the membrane with the graft material. This is the finalization of this case. And I do a summary by the radiographs. You see the initial one, then you can see the immediate post-op with the deformation. And then after the maturation period, there is a shrinkage and then remodeling of this zone. And in the last radiograph, the red line mark the initial line of the sinus, and the green line marks the line of the sinus that I reached by performing the augmentation procedure. So the completely new shape of the sinus floor. In this study, Braga and co-workers made these conclusions. This study shows that in areas with reduced bone height subjacent to the sinus, an osteotome technique may provide a minimally invasive way to obtain implant abutments predictably. The grafted area apical to the implants undergoes shrinkage and remodeling. The original boundary of the sinus is eventually consolidated and replaced by a new cortical plate. My opinion is that these conclusions are valid not only for the osteotome technique, but even for any other crestal technique, and that's very important. During my clinical history, I treated some cases through the execution of a synergy of mini-invasive implant techniques. In fact, I made a combination of flapless surgery planned and performed with the computer-aided implantology technique and the maxillary sinus elevation technique by Crestal Approach. And I want to share with you just one easy and simple case of some that I treated with this combination. This was the initial situation. This is the virtual surgical planning that is done by a software to see and to have a measurement of the residual crestal bone, and also to plan the dimension of the implant and the augmentation that is required. Then this is a surgery, a very easy surgical stent many, many years ago. And then through this very narrow surgical site, I did this kind of surgery by performing this kind of lifting procedure, and then the placing of an implant with a very good stability. Let's see the results. This is the immediate post-op radiography, and you see the dome-shaped deformation of the membrane as always, and this grafted area then have a reshaping and also a maturation, as you can see from the next radiograph. And this was the initial situation in 2007. And this is 2 years later, you see the modification of the sinus floor. And I have also, in this case, 11 years later, another radiograph that shows that the situation about the sinus augmentation is stable. I know that I have a problem in this implant, but the situation where I did the sinus elevation is fine 11 years later. But then in 2015, thanks to another of my professional mentor, Dr. Roberto Abundo from Torino, I kept in touch with the SCA technique that is performed by using the SCA kit that is supplied by the Neobiotech company. And from that point, since now, in all the cases where is required a maxillary sinus augmentation, I personally execute only this kind of technique. And I'm also very glad to be a part of the Italian group that this year published the 2 papers that are mentioned and that you can see on the slides. Now we see the main characteristics of the sinus lifting performed by the SCA technique. It's a crystal approach for sure. It's a very easy surgical procedure to do and also to learn. It has a step-by-step surgical phases control, and it can provide a protection of the sinus membrane, because in every step we use depth control drills. So it's a very safe and simple procedure. This is the step-by-step protocol. It's a very simple protocol to follow, and it's a very simple protocol also to learn. So it's very important to have a very simple protocol, because just following this protocol strictly, we can have very nice, very good results, remarkably result in a very predictable way. Because this technique is definitely a not operator dependent technique. So different operators could reach similar results, and also predictable and remarkable results. Performing this protocol is possible by using some special tools from the SCA kit. One of the special tools is the S-reamer, as you can see on the number 2. This is a special drill that can make a perforation only on the bony cortical plate of the sinus floor without damaging the membrane. Then we have to use a graft material, and this graft material is pushed inside the sinus with another special tool from the SCA kit, the bone inserter. And this bone inserter make it possible to push the graft very gently, and this graft make a deformation and the temporary lifting on the membrane, and also a completely filling on the space that is creating. Another special tool from the SCA kit is the bone spreader, the number 8 that you are seeing. The bone spreaders allow to the material to go laterally, to enlarge the area of lifting, and to have also a better distribution of the material below the membrane. And these 2 tools are very important, very typical from this kit, and that make the difference between this technique that now I'm using from others that I've used in the past. It's possible to use different materials for bone grafting, as shown in this slide. In our Italian group, Any operator used different material. However, everyone reached effective results. This indicates that no matter which material, no matter what operator, the SCA technique itself can allow predictable and relevant results, and that's very important. Which kind of implant is better to use? Which characteristics should have the ideal implant for this technique? In my opinion, the ideal implant should have a tapered shape, should offer an optimal primary stability. That's our main goal to reach every time we perform a sinus lifting procedure and the simultaneous insertion of an implant. The ideal implant should have also optimal thread-to-thread design, optimal thread design, and also regular thread-to-thread distance, and should have also a round apex to minimize the trauma in the case of a direct contact between the implant and the membrane. And personally, always I have to use a lifting procedure. I use this kind of implant from the Neobiotech company, because this implant summarized all these characteristics that, in my opinion, are very important. Mini-invasive crestal approach sinus floor elevation. Let's see some cases, clinical cases that I treated to see the goodness of this kind of technique. So this is the first case I want to share with you. You see the initial radiography. You can appreciate the residual crestal bone, and to put an implant here, it's required a lifting procedure. This is a video from the surgery. This is the exact moment where I'm using the S-reamer that perforate the bony floor of the sinus without damaging the membrane. Then it's possible to check the integrity of the membrane. You see this little movement proves that the membrane has an elasticity, and only an intact membrane can do this kind of response. Then it's possible also to have a vision, as you see, of the membrane through the surgical site. This video is taken through the magnification of the microscope, but it's possible to see, as I'm going to show you later in the lecture, that very often it is possible to see the membrane through the surgical site. And through this narrow surgical site, we are going to perform our lifting procedure in a very safe way and in very mini-invasive way. So this is the typical color of the membrane, that it's very clear. Then we have just to follow the protocol with the grafting. We can use different grafting materials. We have just to put the grafting material in the surgical site. We can adjust the material into the site with a condenser very gently, but then we have to use the bone inserter. This bone inserter push the material up, and the material itself is going to make a deformation of the membrane and the lifting of the membrane. And then now you are seeing the use of the bone spreader, another special tool that make the possibility to enlarge the area, because spreads laterally the material, the grafting material. So make it possible to have a better distribution of the material below the membrane of the sinus. Then we have just to follow the protocol and repeat several times this sequence, just to reach the augmentation that we have planned before. So we have just to follow the protocol, and we have to repeat this sequence before the grafting, then the bone inserter, and then the bone spreader. And now we can see the kind of result that is possible to reach with this kind of technique. This was the initial situation. And this is the final post-op, immediately post-op radiography. You can see the dome-shaped deformation of the membrane reached, the amount of the augmentation that was reached in this case, and you see also the filling of the grafted area. This area is going to have a maturation, to have a reshaping, and also a shrinkage through time. As we can see through these radiographs, 1 month later, 2 months later, and you see a nice remodelation of these graphs. Then these are some photos from the finalization of this work with the second stage surgery, the maturation of the tissue, and also the final prosthesis. And we have also a nice maturation of the soft tissue 2 years later. This was the initial situation with the initial shape of the sinus floor. And this is 3 years later, the stabilization, the result that was achieved in this case. And you see a completely different shape of the sinus. You can notice the great amount of augmentation that was achieved in this case by using the SCAT technique. This is a question that many colleagues ask to me as a critics to this technique. Is it a blind technique? And I don't think so. And my answer is always no. You see from these photos, that is clearly possible to have a vision of the membrane through the surgical site, as we saw and as we are going to see during the lecture, many pictures of the membrane through the surgical site. And it's not definitely a blind technique, especially if you use any kind of magnifications. You can use loops and every kind of magnification to help you to perform this kind of technique. Let's see some clinical case that I treated with this technique to see the goodness of the technique and also the result that is possible to achieve. This is the situation, the initial situation of this case. This is the CBCT scan, and you see different sections. And if you go to the distal section, it's very clear that it's necessary to do a sinus lifting to put an implant here. So I do the virtual surgical planning, where I can measure very carefully and in very precise way the residual crestal bone, and I can also choose the dimension of the implant that I'm going to use. Let's see the sequence of the radiographs. This is the immediate post-op, where you can see the nice shape of the result achieved. This is a CBCT scan just immediate post-op, where it's possible to see the distribution of the material just below the membrane. Then the maturation of the tissue through the finalization of the case. And this is the end of the case with the final prosthesis. This was the initial, with the initial shape of the sinus. This is 12 months later, the finalization, the stabilization of this case with a completely different shape of the sinus floor. Another clinical case. I want to focus your attention on this part, the part with the circle of the sinus with this particular shape, and these are the sections below of this zone. Let's see some pictures from the surgery, the use of the S-reamer to reach the membrane, and you see on the left, down left slide, another beautiful view on the membrane through the surgical side. So it's possible to see the membrane through the surgical side. The membrane is still intact, so we have just to follow the protocol as always, with the insertion of some graft material by the use of the bone inserter that pushed up the material to make the deformation and the lifting of the membrane, and then to use the spreader to spread laterally the material to achieve a very nice distribution of the material below the membrane with a result with a dome-shaped deformation that is typical of this technique. This is the final of the surgery with the immediate post-op radiography. But then 4 months later, in this case, I did a CBCT scan because I wanted to see the shape of the new sinus floor and how the material, how was the maturation of the material and how the material distributed into the sinus. And I was very happy to see these sections because you see now that the sinus is a flat sinus and you have a very nice, you can see a very nice distribution of the graft material and of the lifting that we reached in this case. So this was the initial situation with this condition of the sinus floor. And this is the final 15 months later. As you see in the two circles, the situation before and the situation after, a completely different situation of the floor, well, shape of the sinus floor, also with a new formation of the new cortical bone of the sinus floor. Another clinical case. Here was a bridge with some fractures. I had to extract the teeth. Then after the maturation and the healing, I need to place 2 implants. And the second one need sinus floor elevation. So I did the surgery. This is 2 months post-op and 4 months post-op. You can see the changing that are occurring in the grafted area that is going to have a reshaping during the maturation period. So this is on the left, the initial shape of the sinus. And on the right side, we have the final results 2 years later. So we have a quite long stabilization on the situation with a new shape of the sinus that I reached with the SCA technique. Another particular patient, this clinical case, this patient had an implant, as you see, but then in 2014, he fractured this implant. But fortunately, in my office, I have this Neo fixture remover kit from the Neobiotech company. And this easy kit allow us to remove without any difficulty the implant and to place simultaneously a new implant in the same site. And that's what I did. So in 2014, I removed the fractured implant and I put another one. But then the same patient 2 years later, he fractured one of the 2 remaining roots of this molar. So he came back. I just extracted the tooth. I waited for the healing. And now I have to put an implant in the zone, but I need also to make a sinus lifting, as you can see from the virtual surgical planning. So I took the measurement of the residual crestal bone, and also I planned the measurement, the dimension of the implant I'm going to use. As you see, the initial shape of the sinus from these nice pictures. So this was my planning before the surgery. And this is the result that I reached with the surgery. And I think that two images are quite similar. So I did by the surgery exactly what I planned before on the virtual. This dome-shaped material is going to have a reshaping and also a shrinkage. And after time, this is the situation. This is the evolution of the situation. This is 2 months later and 8 months later. So this was the situation in 2017. And these radiographs show us the situation 2 years later with the result that was achieved. The amount of vertical gain that we reached with this technique, and also a different shape of the sinus that we have reached by performing the SCA technique. But more times we use this technique, more training we do, more skills we gain. So now we are able to treat more difficult and also tricky cases. Let's see a case with the presence of a septum. We all know that the presence of the septum could make some difficulties also in the lateral approach. But as always, I did this case with the crestal approach by using the SCA kit. And this is the nice results I obtained in the immediate post-op. And I know that this dome shape is going to have a remodelation, a reshaping, and also a shrinkage. And this is the situation 6 months later. And I have a modification of the sinus floor. So the sinus shape also in the area just below the septum. Another situation that could be not easy to solve is the presence of non-flat sinus floor. So I have a sinus that is inclined just in the zone where I have to put an implant. But it's possible to solve this situation by the use of SCA kit, as I did. And that's the radiograph that shows us the result that is achievable. Then, after the maturation, I have this kind of stabilization of the situation in this case. Let's see another case that could be not very easy: the presence of the very thin crestal residual bone. We have to be very careful about this situation because we have to reach every time a good primary stability of the implant. So it's very important doing a planning very carefully to have a very good measurement of the residual crestal bone to see if it's possible to reach the primary stability of the implant. That have to be our primary goal if we want to perform simultaneously a sinus lifting and a placement on the implant. And that's why you need a very performing implant in that condition. And I think that the implant that I'm using from the Neobiotech company give me this option. And now I want to show you the result in this quite difficult case by using the SCA kit. This is an impressive result that I obtained. A great amount of lifting, the classical dome-shaped deformation on the membrane, and also the filling by the graft material. And this zone is going to have a reshaping during the maturation, and this is a period of the maturation. And I want to show you the final. So this was the situation before, and you have to notice the shape of the sinus floor just before. And this is 12 months later. the situation is stable, all is matured now, and I had a completely different situation on the sinus floor, a new cortical plate, a different shape of the sinus, and a very relevant height of the residual crestal bone that I gained by doing this procedure, by this technique. So this is 20 months later. It's almost 2 years later. And this is possible by doing a crestal approach through the SCA kit. And finally, our enhancing skills bring us in the expert zone. So these allow us to treat even some particular cases. This is one of the particular cases that I want to share with you. We have the simultaneous presence of two zones, one with the inclined sinus and one with the very thin residual crestal bone that for sure doesn't allow us to put an implant in this zone. Let's see the sections. The distal section can allow us to put an implant without any lifting procedure. The mesial zone near the premolar can allow us to put an implant because we have seen just before that it's possible to use the SCA kit also if the floor of the sinus is inclined. But then in the central position, what we are going to do, because it's impossible to put an implant here. So let's see from the virtual. I do the planning. I wanted to put two implants, one distally without any problem, without any lifting procedure, and one in the mesial where it's possible to put an implant using the SCA kit. And this should be the result by using the normal procedure of the SCA kit. But in these particular cases, I wanted to have a different result because my desire was to reach a result like this, to have a nice elevation of the flap, of the sinus floor, to reach a flat new sinus floor, very similar to the one that is possible to reach with a lateral approach. And I want to show the surgery to see if I reached this kind of situation or not. So let's see the surgery. These are some photos from the surgery. I did a different approach because I prepared one side near the premolar where I have to put an implant and where I planned to put the implant. But I also prepared a site in the central zone where I have a very thin residual crestal bone. In fact, I reached immediately the membrane as shown in this photo. In that particular site, I decided to do a preparation and a protocol like a future site. So I decided to perform only an elevation, only a sinus augmentation in this zone without putting any implant. The first layer I used is a little piece of collagen that is gently pushed on the membrane to have a protection of the membrane. And then on the collagen, I've just used a graft material as always, and I just followed the procedure, the protocol of the SCA kit procedure as always. So I inserted some graft material. I used the bone inserter to lift the membrane through the use of the inserter and through the pressure of the graft material on the membrane, and then the bone spreader to enlarge to have a better distribution of the material below the membrane. So that's what I gained. As you see from the photo, you can notice on the last photo that on the stop, we have the number 5. That means that we have at least 5 millimeters of elevation that I reached at that time of the protocol. But then I came back to the surgical site where I have to put an implant near the premolar. I used the S-reamer to reach the membrane, and another time you see the membrane through the surgical site. So it's possible to check the integrity of the membrane, as you can also see quite well the residual crestal bone that is possible to see through the surgical site. And through this surgical site, we are going to perform our lifting procedure with the SCA procedure, with the SCA protocol. The first layer, we use some collagen, then we use some bone substitute, and this bone graft is pushed up by the bone inserter and then the bone spreader. So it's always the same protocol that we follow. At the end, I use the final drill to put the implant, and when the site is finished, I just put the implant by screwing it in the site. After that, I passed in the distal site where I have just to prepare to drill the site that I'm doing in this photo. And then when the site is ready, I have just to insert the implant. Last thing, I wanted to enhance the augmentation, the elevation in the central position. So I went back and I put other grafting material, and then using the bone inserter and the bone spreader, I just made more elevation, and I reached more quantity of elevation. At the end of the surgery, I just put a membrane as a protection of the site, and also to have a better healing of the soft tissue, and just suturing with the EPTFE suture. So this was my initial desire, what I wanted to reach, I would like to reach. And this is the radiograph of the immediate post-op. And you see that the image is very similar to the one of the planning. And also from the immediate post-op CBCT scan, you see a very nice result that is very similar to the one that I planned before the surgical. Let's see the section, the distal section, where there is the implant without any lifting procedure, but then the impressive result of the central zone, where I gained more than 10 millimeters of height of the augmentation. And then in the mesial, where there is the implant, and when I did the augmentation procedure with the inclined sinus floor. Let's see the maturation also of this case. 2 months, 6 months later, the second stage surgery. And this was the initial situation with this kind of sinus shape. Let's see the final results. This is the final 3 years after loading. You can see the stabilization of the results, a very nice result, a great amount of lifting that I reached, especially in the central zone, and all is stable. You see also, you can appreciate also a new cortical plate of the sinus floor. And I definitely think that this kind of result is quite similar to the one that is possible to reach, in this case, with a lateral approach. But I did this by a crestal approach by using the SCA protocol, the SCA technique as usually. if I can do it, if I can do this kind of cases, I think that everybody can do it. In fact, and to confirm this, I want to share with you some clinical cases from some of my course's students. This is from Dr. Grilli, a friend of mine, and he also gave nice results if you compare the initial situation and the final. Another case from Dr. Grilli, this was the initial, and it is the result he achieved also in this case. Nice results with a different operator. Two different operators, other two colleagues, two different cases, and you see these radiographs, the dome-shaped deformation and elevation of the membrane that is achievable when is performed this kind of technique. So different operators, similar results, very nice results for every different operator. That's the goodness of a non-operator dependent technique like the SCA technique. But then I asked to myself a question: are there limits with the SCA technique? And I don't think so. I wanted to treat some tricky cases to know my limits and also the limits of this technique. And I want to share with you some of these cases. With one of these, with a very, very fine, little residual crestal bone. And I decided to treat this case by a double, with a two-stage surgery approach. So I treated the Has future site, and this is what I reached with the first surgery, just to make a lifting procedure. And after 4 months from the CBCT, I had the quantity of bone that I gained with the first surgery. So now I just have to put some implants. And this was the result that I achieved. And this is 2 years later, the stabilization of the results. But then I want to show you, I want to share with you this extreme clinical case. And I want to share with you this kind of provocation of this case because of the very thin residual crestal bone. It's a case that usually it's considered to be treated with a lateral approach. But I wanted to treat this with a crestal approach, and that's what I did. So I used the SCA kit, and I choose to make a multiple sites approach with the S-reamer to reach the membrane. So I prepare very close to the other multiple sites to elevate the membrane. And then you see that I connected the sites, and you see these tools from through the sites, and the membrane is intact, is below the tool. And then after the elevation of the membrane, I use the SCA kit to go on with the filling using the bone inserter and also the bone spreader to push inside the material. I use this oscillotome just to take the measurement of the lifting that I reached in that particular zone in that time. And then I just finished the filling of this zone by grafting other material. And this is the end of the filling. Then I approached the other side, always using the SCA kit, 2 different sites that are connected one to the other, like the other side. I did the sinus lifting procedure with the SCA kit to 8-9 millimeters. Then I just finished the filling, and you see the final of the filling. So let's see the results. I did the CBCT scan, just when I finished the surgery. You see from the sections on the left side, the nice results that I achieved. And you see from the measurement, the vertical gain that was reached on this particular case. And you see also on the section on the other side, the same. So I think that in this case, I reached the result very similar to the one that is possible to reach with the lateral approach, but I did it by a crestal approach. Let's see the radiographs. This was the initial. This is 1 month up. This is 3 months later. And unfortunately, because of the emergency, the COVID emergency, I can't share with you the final result because this patient now is not available because he had the problem about the COVID. And I hope that I'll be able to show you in the future the final of this case. In this study, Ferrigno and co-workers concluded that from the clinical point of view, the predictable use of short implants in conjunction with osteotome sinus floor elevation may reduce the indication for complex invasive procedure, like sinus lift and grafting procedure. I completely agree with these conclusions. And I think that the clinical case you have seen proved that these conclusions can be valid not only for the osteotome technique, but even for the SCA technique. In fact, I strongly believe that the transcrestal approach is an effective way to implement the many invasive implantology in sinus augmentation cases. And the clinical cases I've just talked about demonstrate that I have reached the target as well as everyone who uses the SCA technique could do. I'm going to conclude with the words of Leonardo da Vinci. Mastery, and in our case, dentistry mastery, is the daughter of research and experience, and especially in our daily clinical practice. And now I want to thank you for your attention, and I'm ready to answer to your questions.